Hello, everyone. My name is Karan Jatwani. I'm one of the third year oncology fellows at Roswell Park. I'm so glad to be here. We have Dr. Matthew Kurian from St. Elizabeth Healthcare Cancer Center, and we have Dr. Karine Tawagi from University of Illinois Cancer Center in Chicago. We will be discussing the next portion of our talk, that is metastatic prostate cancer or stage 4 prostate cancer. Um, so just to start off, just the basic outline of what we are trying to accomplish during this talk would be: what is the definition of metastatic prostate cancer? How do we define or how do we differentiate as clinicians between a hormone-sensitive prostate cancer, a hormone-resistant prostate cancer? How do we diagnose the metastatic prostate cancer, and what is the role of a PSMA PET scan? And is it any different than traditional imaging? And last but not the least, we'll go over the basics of treatment and monitoring, the current medications that are available, and what is the future of the medications that we have available, and the quality of life effects of these treatments that we give to our patients, along with their toxicities and their side effects. So just to start off, I think we are going to focus on the stage 4 or metastatic prostate cancer, which essentially means that the cancer is not limited to the prostate itself or even the lymph nodes, and it has gone into other organs. Most commonly, we see that going to the bones. This is the sort of focus of our topic. So, Dr. Tawaji, I wanted to ask you, I mean, we see that there are some symptoms that are mentioned here, but when you see patients in your clinic, what are the most common signs or symptoms patients present with?
I think urinary symptoms, so issues urinating, waking up frequently to urinate, issues in initiating urinary stream, as well as bony pain might be some of the most common side effects that patients may initially present with, and then they're found to have prostate cancer. Sometimes stage 4 prostate cancer is just found incidentally because the level or the PSA level in the blood is elevated.
Yeah,
Definitely. I would agree with that. I think that there's a wide range of, different patients. Some patients that, depending on the burden of disease, may have differences in their symptoms, like Dr. Tawagi had said. Some patients, may not have any symptoms at all, or, may have things like, appetite loss, generalized fatigue, other things like that, that may be a little bit more non-specific and a little bit harder to catch, I think, sometimes as well. Especially in the early parts of the disease, but definitely someone that has a lot of, cancer that's gone into the bones or in the liver or other areas, may have some of these symptoms that are outlined here on the slide as well.
Yeah, and I would just add, I think, erectile dysfunction and swelling in the legs generally might be a side effect of the treatment of prostate cancer rather than the initial presentation.
Definitely.
and I think one thing we wanted to talk about here would be that most of these patients follow a continuum of progression to metastatic disease. So, Dr. Dawagi, can you speak a little bit about that? That metastatic disease on its own could be a smaller portion of these prostate cancer patients, but can you discuss like patients who have localized prostate cancers and they might have progressed to metastatic disease?
Definitely. I think there are definitely patients that have a history of localized prostate cancer where maybe they had surgery or they had radiation and then they're monitored with a prostate level in the blood over time. And then eventually the cancer comes back and spreads, and then it's considered stage 4, versus, as you mentioned, patients that never had a history of prostate cancer and are diagnosed with new stage 4 prostate cancer at the onset of diagnosis. Thankfully, with the screening that we have for patients that are at high risk for PSA, like we talked about in our last session, we can hopefully detect patients before they get to stage 4. But there still are a lot of cases where patients are diagnosed at stage 4.